There is a lot to unpack this morning with regard to the president's care and other issues, such as whether the vice president could test positive and the so-called super spreader event in the Rose Garden. Hi, I'm Dr. Brian McDonough. It is Saturday, October 3rd, trying to provide you with some updates to the best of my ability. These are obviously semi-regular based on the time I have and also if there's information to share. First of all, about the president. We obviously all wish him well. He's in a great facility. Walter Reed is a wonderful hospital. In addition, he clearly has the best care. He was given the medication remdesivir. Now, you may have heard about remdesivir. In my own care for patients, when I first started using it, when we first were able to start using it in a hospital setting and it was a little more widely spread, we used to only be able to give it to people who were in the intensive care unit. But as time went on, at least at my facility, we were able to give it on the floors. So I actually had patients who may have been exposed 5 days earlier, and we started remdesivir because they'd been in the hospital trying to offset bigger problems. So just because he's getting this medication doesn't raise alarms. Beyond the alarms we already have because he's hospitalized and he had symptoms such as fever and fatigue. The next issue is whether or not Joe Biden could still test positive. Joe Biden and others still could test positive. And let me explain that. What happens with COVID-19 is that you're initially exposed. When you're first exposed, obviously you won't test positive right away. You have to build enough level in the blood to be tested and be detectable. But for some people, it can take several days to find out if you are positive. In fact, many people don't even know if they go asymptomatic. They don't even know if they might have been exposed, and they find out months later by an antibody test that they had it at one point. But the thing is this, in those early days of exposure, you are the most contagious. So if in fact the vice president is positive right now and not testing positive, he could be very contagious. And that's a concern we have. And some concerns about the inconsistencies in things. I saw where the president was taken on Marine One to Walter Reed, but the people with him weren't in PPE. And in fact, the president, it looked like he didn't even have an N95 mask on. We really need to be careful. When someone is positive in a hospital setting, we are aggressive about protecting ourselves because ultimately we're protecting others. Now, I can't criticize who's leading the president, but what I'm looking at is some inconsistencies on the need for intense care. With this virus, what you need to do is be aggressive at preventing it. You don't want to take any shortcuts. And that brings us to the so-called super spreader event in the Rose Garden. I know there's a lot of talk, and this is important for everyone out there, for your family and your loved ones. There's a lot of talk about you're safe outside. You're safe outside to an extent if you're smart. Today it's a beautiful day on the East Coast. I plan to go out, and I want to go out and I want to walk and hike and kind of get out there and just forget about all these things. I'm going to bring a mask, but if no one is around, I can hold that mask and I can just take care of myself because I'm not spreading to anyone. But the minute I get in close proximity to anyone else, I put on the mask. I do it for two reasons. I don't want to get COVID. But think about it. I'm exposed to COVID all the time. I don't want to give anyone else COVID. And that's a two-pronged attack. You have to realize when you're wearing a mask, you're protecting yourself, but you're also protecting everyone else. And we don't always think that way. We probably should, but we just think about ourselves in many cases. So in that Rose Garden event, you had people in close proximity and people who were not wearing masks. And it'd be interesting to see a breakdown of those who wore masks or those who didn't, and whether or not there were any positive cases. I don't know if they can do that, but I'd like to know, because if you really think about it, the argument now is that, well, if you're wearing a mask or not, you don't get 100% protection. And that's true. But if you drive a car at 150 miles an hour and you don't have an accident, it's fine. But if you have an accident, you're probably dead. So my feeling is, we don't know if the mask protects 100%, but we do know it's better than nothing, and it's the best we got. So my advice for people watching this is look at an event like that and how many people we believe tested positive from that event, or you could speculate it was positive because they were together, and that how something can happen in an outdoor setting if you're not taking the proper precautions of a mask, social distancing. Just remember that for yourself and your family. Whatever your views are on masks, look at this logically and think about yourself and the health of your loved ones. and I think you might find yourself wearing masks.